The workshop that I do is done on a monthly basis. It's done for professionals and parents. The reason being is oftentimes professionals do not understand what your lives are like. And I will be the first person to say that although I spent 20 years helping my aunt and uncle care for my 2 cousins that have Down syndrome, unless you are actually the parent of a child with a disability, you don't get it. And that goes for the medical community, that goes for psychologists, psychiatrists, everybody. So the other part of it was really just to get you guys the same information that I'm giving to them so that everybody is on the same level as far as playing field and knowing what's going on. So you have everything in the packet that I'm going to talk about. I'm going to bounce around. I'm going to be all over the place. I'm very ADHD, and I've had a lot of copies. So we're going to, and this is typically an 8-hour, I mean, really, in all seriousness, this would be an 8-hour conversation. I've reduced it to 2 for the monthly workshop that I do, but then for today, I've reduced it to about 1 hour and 20 minutes. But just know that everything that I talk about, you have in either the handout or the PowerPoint, so you will walk away with it. So we'll skip through a lot of this stuff. What I really want folks to understand is, number one, 1 in 5 Americans has a disability, so disability is natural. I grew up next to my cousins with Down syndrome. When I was born, they were 10 and 12 years old. I never knew that there was a difference between people with disabilities and people without disabilities. The only way I became aware of it was by how the community reacted to my family. And oftentimes it was through those conversations like, oh, well, there's those retarded girls that live down the street, or, you know, because we're back in the 60s and 70s with this conversation, so language that people used was not really dignifying or respectful of the people that they were referencing. So that became a big issue for me because these were my cousins. I loved them. I saw no difference between them and me other than we just learned a little bit differently, and I may be able to learn it after you telling me 3 times, but with them it might have taken 500 times, but ultimately at the end of the day we got where we need to be. I created this workshop because nobody gives you a book when you have a child with a special health care need when they're born and said, this is what your new world is all about. Nobody does that. Nobody explains to you that those of us that work in this industry talk in acronyms. Everything is DCH, DBHDD, you have this, you have ESD. And you're like, what are you talking about? No one tells you that. So what I did was I took what I learned from watching my aunt and uncle and what their life was like bringing up these 2 young ladies, then what I learned as being a support person to them in addition to what I heard from the community. And then I went into this field a few years ago and started working with parents, biological, adoptive, and foster parents of children with special health care needs. And I thought, we are missing something. We are really missing something important here. So that's what this is all about. So we're going to kind of bounce through here. Self-care. I always do a 5-minute lecture on this, and it's because this is so important to me. And Linda is going to do some great work with this later on, so I'm not going to tap into this too closely. But I need you to know one thing. You cannot be the best parent that you can be unless you are taking care of yourself. And some of you are single parents, some of you are married. I recognize that every family is different, but what I'm asking you is if you do nothing else, honor yourself by taking 20 minutes every day where you lock yourself in the bathroom or in the basement, meditate, pray, sing a song, take a walk, but just dedicate 10 minutes of every day of your life to you. Because if you are not rested and in a position to deal with not only raising the child, but also dealing with all the different systems that we're about to talk about, this will burn you out. And the other piece to the self-care is isolation. Isolation is such a dangerous area for me because you oftentimes become isolated before you even realize that you become isolated. And how it happens is because of the fact that we live in a community that does not necessarily look at people as individuals with their disability just being a portion of who they are. They look at people based on their disability. So yeah, you have to have diagnosis and you have to have labels because in all actuality, let's be serious, that's what drives the services that you're going to get for your child. However, when you're working with your child and living with your child and going through day-to-day life with your child, the disability should only be a part of who they are. I was in a lecture the other day, this is kind of embarrassing, but we'll go there anyways, and I was working with DFACs, and there was like 300 people in the room. And I was helping them understand that when you're working with children with special health care needs, you have to take a different approach to how you work with these kids. And we started getting into this whole, diagnosis and label things. Meanwhile, all the people back at the office that I work at were going through a cultural diversity training. Now, I know I'm kind of going off on a tangent, but this will all come back together in a minute. So one of the girls that was sitting out in the audience, in the DFACS audience, knew one of the young ladies that I worked with, but she didn't know who I am and I didn't know who she was. So all she did was texted to my coworker who's in the middle of a cultural diversity training, hey, there's some really hyper guy here with the bald spot talking about kids with disabilities. And Catherine's like, I know who you're talking about. You know what I mean? And I'm like, okay, so we're in a cultural diversity training. I'm talking to another group of people about disabilities and how to honor people. And we've got this woman out there saying, some guy with a bald spot that talks too fast, blah, blah, blah. But what it basically comes back to is our children's self-esteem are affected on a daily basis by everything that they come into contact with. And our community, again, is not built in, or educated, I should say, on honoring people for who they are. We always start attaching these labels and these diagnoses, and that becomes who the person is. And I have a very big issue with that. My cousins Sue and Joanne are people. The fact that they have Down syndrome and the fact that they have cardiac issues associated with Down syndrome, which 50% of people with Down syndrome do have, those are all characteristics of who they are. So yeah, I'm aging, I talk fast, I'm balding, I'm kind of getting a little wide around the waist. Those are all characteristics of me. They do not define who I am as a person. And I get really upset when I'm working with children in the foster care system and I start hearing people say, oh, well, there's that Down's child and there's that autistic child and there's a retarded kid. And I'm like, whoa, let's just kind of step back for a minute and think about what is the child hearing? Just because a child has a disability and maybe their IQ is not at 120 or 100, maybe their IQ is at 80 or 70 or 60 or 50, it doesn't matter. Negative feedback and negative conversations still affect who our children are. And if our children are raised thinking that there's something wrong with them because they have autism or wrong with them because they have a cardiac concern, that affects who they are going to become as a person later on in life. So the People First movement, which is really kind of what this first part of this conversation about, is just recognizing that the person should always come first. When you're in an IEP meeting, it's not a Down's child, it is Sally who has Down syndrome. Or if you're in a hospital setting, and I've never heard this happen in CHOA, and that's why I love CHOA, but I was working in another hospital setting with a medically fragile child, and the foster mom came in with the child. I just happened to be there as a support to this foster mom. Nobody knew why we were there, and the nurse behind the thing yells back to her coworkers, oh, that foster kid is here. Well, does it really matter that it's a foster child? Isn't it ultimately just a child and in reality just another human being? So what I tell folks is we really do need to be cautious of the language we use because it does have an effect. There was one mom I'm worked with about 2 years ago. Her 15-year-old son has cerebral palsy. Well, cerebral palsy has no effect on your cognitive abilities. It is an issue where your brain and your muscles don't necessarily communicate and function together as they do for those of us that don't have cerebral palsy. So every day this little guy is going to school, and because he does not communicate verbally, and because he's in this wheelchair all the time, and because he's got contractions and his body looks a little bit different than those of us that don't have some sort of special health care need, he sits in the hallway and hears kids say, oh, there's that cripple, and all the stuff that kids say, because we as a community have not yet come to understand that just because I can't talk does not mean I cannot hear. And then keeping in mind, too, that disability is not always visual. You walk a very dangerous line when you judge someone based off of how they look as to whether or not they're disabled. I work with people all the time that have cerebral palsy that you would never guess have cerebral palsy because it doesn't mean you have to be in a wheelchair full-time for your mobility needs. You know what I mean? So all I'm asking is for folks just to kind of step back every once in a while and just kind of be aware of the language that they use, because this little person that was going to high school would cry every day and beg not to go back because he was basically just devastated because he couldn't verbally defend himself in the school system. And then his mom is struggling with, well, what do? Do I pull him out of the school system? And is that in his best interest? And in fact, does that actually not just make it worse for the community, because then the community is allowed to keep perpetuating these stereotypes of what disability is. You know what I mean? So I'm going to get off that soapbox, but I just say to people when you're talking, yes, ma'am.
I'm going to interject for a second, Joe. Our group is called Kids at Heart, obviously, and and we have 900 families who have children with a cardiac condition that are in our group. And when the group was started, we called our kids our heart babies or our heart children.
Which
and
I love
think
that.
that's how we refer to them still to this day in this room. However, I will let you know that Children's is starting to give us pushback if we send out some type of material that says our heart, this conference, Parenting Your Heart Child Conference, we had to go to the powers above to get approval to still have this conference and call it that. They're asking us not to do that anymore. So maybe at the end we could take a poll on what you guys feel like we should call our kids now, because it's been that way for so many years, and I don't think it's offensive to anybody in here. However, we can certainly discuss other things to say. They wanted us to call us Parenting Your Child with a Heart Condition Conference.
Well, that doesn't really roll off the tongue very easily.
It definitely pertains to our group, and and I never really thought about it in that way, if that is offensive to any of our parents, but a group of parents started this group, and that's what they called their kids, and so we have always
Allison,
gone along with that.
You bring up a great point. People first language is up to the individual and how that individual wants to be referenced and perceived. There are a lot of people in the community with disabilities get very angry if you use people first language because they feel it distracts from their ability to advocate on behalf of themselves with their disability. So I completely honor the fact that you would ask everybody, because it is very much a personal thing. I work with a lot of folks that have cerebral palsy that they want you to know that they have cerebral palsy because they feel that's how you educate the community. I completely support that. It is never up to me as a person without a disability to decide how people will be referenced. What I do say as far as people first language is concerned is when I meet a person with a disability, I always go to people first language first as a way to honor and make sure that they are maintaining dignity and respect, and then I let them correct me from that point forward. Because I completely respect there are a lot of people out there that have autism. They want you to know they have autism because they feel it's important that you see how they function within society and that they can function within society. So it is a two-way street. The only thing I say, and I hope that you understand where I'm coming from on this is let the person decide how they want to be referred to, because we all have that right, but as people without disabilities, it's something that we just never think about. We just take it for granted. That's a great point. That's a great point. And you're right, the other thing doesn't really roll off the tongue real well. And I'll be honest, I thought Heart Kids was, actually I thought it was really sweet. So, but I work with kids, so I'm kind of like that. So you got to kind of put that aside. The other thing that I think is so important about this is the isolation piece. It is so easy for a caregiver to become isolated, again, without them even being aware of it. And the story that I was sharing with Linda, and this is me not knowing when to keep my mouth shut. I walked into Target one day, and as soon as the doors open, I hear a kid melting down on the other side of the store. And I just, all right, went in and got my buggy, and I started off on the other side of the store. And it took me about 15 to 20 minutes to make my way over to the other side of the store, but the entire time, there's this there's this scream that just sort of keeps going on endlessly, the whole 20 minutes I'm there. So about 10 minutes into it, I'm thinking, okay, this isn't just a child that is having a bad day. This is more than likely a child that has sensory issues or is on the autism spectrum and is having a really hard time processing the information that's coming. So I finally worked my way over to the other side of the store. You can tell I haven't paid attention to this at all. I finally worked my way over to the other side of the store, and there's this child, and I never say he or she, so I'll kind of fluctuate back and forth just for dignity purposes, laying on the floor, just letting loose. I mean, this kid was not happy about being in this store, and the mom was just standing there very calmly, just kind of like, watching Johnny go through his meltdown. But what irritated me were there were 20 people standing around her, staring at her like, are you going to do something about this? And I got upset. And usually I don't say anything. Usually I'm like, it's not, but I just simply said, is anybody helping her? Because if you're not helping her, then go shop so that she can continue working with her child on behavior redirection and the things that these kids need in order to teach them how to operate within a society that still does not understand who they are. So there's a flip side to that, though, all right? Because I think I know so much about this people first language, and I didn't start this. This has been around for 40 years. But it just shows you sometimes you forget. I was in Kroger not even a week later, so this had to be a karma thing, and there's this elderly gentleman in one of them little scooters tearing up and down the aisles, and I happened to be standing behind him, and he rounded the bend and took out the entire display of razor blades. And I was like, oh no, he must be so embarrassed. So I run over there and I'm trying to help him. He's like, I did not ask you for your help. And I was like, you're exactly right, you didn't. And somebody who sees themselves as a disability advocate obviously was not using his common sense and assumed that just because this gentleman was in a scooter that he needed my assistance. No. I should have, in all actuality, say, look, I'll be more than glad to give you a hand with this or get someone to help you. But for me to just go over and started doing it, completely disregarded who he was as a person. Valuable lesson. Valuable lesson. How would I have wanted that to happen? Would I have already been so embarrassed that I just wiped out all of, you know, I'm talking hundreds of razor blades, you know, and then do you want everyone running over and helping you, or does that really just make you more of a spectacle to the people that are around you? All right, so that's kind of just a sort of a segue into understanding that behavior is communication. A lot of the little people that I work with do not communicate verbally. They may do eye direction, eye pointing, or they throw a book at you, whatever it is that is their method of communication. But it's getting folks to understand that just because a child is exhibiting a behavior does not mean that it has a negative connotation to it. If you cannot verbally say, I am in pain, and nobody is hearing or paying attention to the signs that you're giving out that are indicating that you're in pain, then yeah, I am going to throw a book at your head because that's how I'm going to get your attention, and you're going to be like, what is your problem? And then maybe you'll realize that I cannot reposition myself within this chair and I'm in a lot of pain. So what I tell folks is sometimes we need to step back from what our definition of what behavior is and the judgment that we oftentimes may heap upon people simply because we don't understand the circumstance. So I think that if you get anything else out of this little tangent that I'm on, that if maybe the next time you're in a store and you see a mom struggling, or if you are in fact that mom that is, or dad that is struggling because your child decided that this is when he or she is going to just let loose because they don't want to be there, how are you going to approach it? What would you do if it was somebody else? And then what is the best way to dignify the family without making mom feel like I can no longer go out into public? Because what will happen is the next time she has to go to Target, she won't. And then she'll stop going to the grocery store, and then she'll stop going to the library, and then she'll start, and eventually what will happen is mom and dad just become completely disassociated from their community. And this is what brings down a family. Nothing is more devastating to a family when your whole world becomes involved within the four walls that you live within, because that is not what life is about. Life is about the broader community and being participating within that. So a lot of times, by the time I start working with families, we're already kind of in that disintegration point. We no longer go out anymore. Mom and dad are depressed because we no longer go out anymore. Mom and dad are not honoring their marriage because they're so busy taking care of Tommy and making sure that he doesn't wander out the door and down the street that they are not being husband and wife. And you have to have that there. You are each other's support team. And until the rest of the community understands that it takes a village to raise a child, you don't have anybody else but each other and your immediate family. So the isolation thing is always very scary for me, and I always tell people you've got to be connected to your community. There is a foundation or an organization or a nonprofit somewhere in the state of Georgia that basically represents every disability or special health care need that is out there. Now, I'm not saying go become the president of it, but at least know that it's out there, at least be aware of the website, and maybe once a month or maybe once a quarter, just actually attend one of the events. Because you will be much more successful if you leave this room today knowing who these other moms and dads are in this room, and knowing that if you are having a really bad day and you just need to pick up the phone and scream for a minute, it's going to be one of these other people in this room that are going to understand where you're coming from. Again, I am not the parent of a child with a special health care need. I've had many, well, 40-some years of experience with the population of people. In addition to my loved ones, I will never understand your daily journey. And your sister who doesn't have a child with a disability, or your brother or your parents, don't get it either. And it's not that they don't want to, but until you're living it, you don't truly understand the stress and the frustration and everything that comes with it. Now, I know that this is not an uplifting conversation, but I want you to see what I also tell the community of people that do not have children with disabilities, because I get very angry with them because oftentimes they think that, well, you know what you need to do 1, 2, 3, 4, and 5. And I'm like, when you're sitting in a doctor's office, that sounds great. But when you get home and you're trying to cook dinner, go to work, Johnny's running around the house, melting down, or Sally is, you know, freaking out because she can't get her homework done and she's ADHD over the edge kind of thing, and you know, you're just trying to hold yourself together, actually maybe even take a shower that day, people don't understand that. So again, a lot of what I'm telling you, you do understand. Sometimes I think parents just like to rehear it, because I think it validates those feelings in you that oftentimes you feel that people don't get. But really, a lot of times this is more aimed towards those professionals like within the Department of Community Health or DFACS, so that when they're engaged with you, they can take a deep breath and say, you know what, let this mom have her moment, or let dad scream about, you know, what he's experiencing, and actually honor it, because it is the reality of it. All right, so having said that, where are we at with this thing? Language, did that. All right, so getting services for kids with disabilities and special health care needs is sort of like, I don't know, it's sort of like, I can't even describe it. No one understands it. There's no one person you can go to that can completely walk you through anything. I can do kind of a good job, and hopefully you'll walk away with a little bit of understanding of what goes on in the state of Georgia. But I'm not going to lie to you, I don't understand everything either. So when you contact me with questions, which you are always welcome to do, that is what my job is. If I don't know it, I will tell you who to go to, or I will pass you on to them, because I want to make sure you're getting the right information, because Lord knows there's enough wrong information out there already. So one of the things that you need to understand with your medical team, with your child's school system, with any service that you interact with, it has got to be a partnership. And I know when you're on the phone with Medicaid, it would be so much more exciting just to go through the phone and choke the living daylights out of the person on the other end of the phone. But in all seriousness, that person doesn't even have the authority to make the decision you need, and chances are, you know, they're just like, they don't even know what to do. So anytime I call Medicaid, the first thing I do is, when I tell them who I'm calling about and they're poking it into the system, I say, how's your day going today? I bet it's really crappy. You know what I mean? Go ahead and acknowledge these people have horrible jobs, because I would not want to do that job myself. So by honoring the fact that they are probably not very excited about what they do, it decompresses the situation and everybody just kind of relaxes, and then you're going to actually have the ability to have a conversation with somebody who's not going to be like, well, I don't know what to tell you. You would be surprised how many times parents call me and say, I just called Social Security to find out how to get SSI, and they told me to divorce my husband. And I'm like, what? But the reason that they're being told that is income. You know what I mean? Where are we as a people when we're telling a family that it's in their child's best interest to be divorced so that they can access services? But that is the reality of this situation, because all the services are always going to be income focused. So my goal here is to kind of give you some of the backdoor loopholes to getting those services and how to get that income piece taken out. So I don't know where we're at with this. Partnership, partnership, partnership. You know what I mean? My grandma used to tell me from a little kid, you will always catch more flies with honey than you will with vinegar. So if you just keep that in your brain as you go through the rest of your life, it does make life a little bit easier for you in the long run. In addition to that, I'm going to say this now because I will forget later on, is do not do anything verbally. Anything you do has got to be written down, and any correspondence you have with any of the state agencies that we are about to talk about have always got to be in writing and has always got to be done through certified mail. Because I promise you, the mail office at 2 Peachtree Street is on the bottom floor, and the people you're working with are on the 40th floor. And if you did not mail it certified mail, I guarantee you it got lost somewhere around floor 15, and it will never be found again. So if you make sure that you send it certified mail, you have confirmation of delivery and you know who signed for it, and it is now their responsibility to find your application packet that you just spent 2 weeks putting together. In addition to that, make sure that anytime you submit an application package that you go ahead and run an extra copy of it just in case. So when they do call you and say, I don't know what you're talking about, you can go ahead and mail the other one out. All about being proactive. I do this every day, and you know, and I'll be honest with you, the one time I did not do something certified mail, and it was really important application for this little kid, it got lost, and I was like, unbelievable. I don't even listen to my own advice. So what I do with the foster families that I work with, because our agency has a foster care division as well that's separate from my program, there's about 77 kids in that program that either have some sort of special health care need or a developmental disability. That is all we do. So I learned a lot from watching the struggle that mom and dad were going through, as well as the foster parents. I'm thinking this whole thing is crazy. So here's the rule. You need to have 3 notebooks, 1 medical notebook, 1 developmental notebook, and 1 educational notebook. And when we start talking about the Beckett waiver and all the other programs you have access to, you will truly understand why these notebooks are so important. Because when you're trying to access services for a child that has a special health care need, the people that are going to be reviewing your application want to know what has gone on from day 1. How many people in this room have the medical documentation from the time their child was born? No one. Who does? You know what I mean? But that's, and congratulations, because you have to do it. You have to do it. Children need structure and routine and organization as it is. Children, regardless as to whether or not they have a disability. Our role as parents and caregivers is making sure that we're providing that structure and that organization. The first part of it is the documentation piece. If you're going to try to go get a service and they call you back and say, well, we need this form from 1908, where do you start? How long does it take to get the release of information for the hospital to even release that information to you in the first place? You need it today, you don't need it 30 days from now. So the medical, the developmental, and educational notebooks are fabulous because as soon as you leave the doctor's office, make sure you walk out of there with something in your hand that can go right into your notebook so that when you're applying for Katie Beckett and they want to know everything about you from the day everybody was born, you have it and you can plunk it down on the desk and say, there it is. So keep that in mind. It's all about organization, structure, and routine. Correspondence should be in writing. There's your notebooks. I'm actually doing pretty good with staying with this. Also, become familiar with the organization that represents your child's disability. If your child has cerebral palsy, you need to be involved with the United Cerebral Palsy Foundation. If your child has epilepsy, the Epilepsy Foundation of Georgia, the Down Syndrome Association of Georgia, there are mitochondrial disorder groups, there are ADHD groups. CHAD is a fabulous ADHD group. You need to be associated with that organization because that's where you learn about great doctors, great therapists, great camps, great funding to pay for those camps. Other parents have already lived this and have already gone through this. Do not reinvent the wheel. You do not have the time. You know what I mean? Use that time to spend doing something fun with your kid instead of sitting there reading a 500-page manual on Medicaid. Someone else has already done it. Don't reinvent the wheel. But that's really what this partnership thing is all about. Have that contact, that other parent that you can call and say, I want to either choke myself, this child, my husband, whoever it is, I need to choke somebody. Because that mom and that dad will understand exactly where you're coming from because I guarantee you they felt it before. I was a foster parent. I am no longer a foster parent because I was like, wow, me and this 2-year-old, there's like, wow. You know, I loved the experience, but in all reality, some of us are just not meant to be parents. And that is how I learned that lesson. But then I was thinking to myself, well, what if he would have had some sort of special health care need and it was just me and him? What would that world have looked like? The whole toothbrushing thing for a 2-year-old can be a very devastating thing. And it can be a very frustrating thing. And I walked out of that like, why won't he just brush his teeth? You know what I mean? And you don't want him to go to daycare without brushing his teeth because then you're like, they're going to think you're not taking care of this kid. But have you ever tried to brush a 2-year-old's teeth? No, it does not work. Yeah, you know, yeah. And people wonder why when I work with families that have children with developmental disabilities, there is a dental foundation that works with people that have developmental disabilities. Go to them. They are specialized in this because if you take your child, and I work with some pretty complex little people that have like 10 different diagnoses. I walk into a dentist's office and they're like, you have got to be kidding me. You know what I mean? I'm like, yeah, we need like tranquilizers for everybody in the room. You know what I mean? Because this is going to be a process and I'm not sure who's going to walk out of it. You just don't know. You know, there's one little girl that I work with, she has what is called classic autism, which is the autism that you see, the flapping and the self-abusive behaviors. She has a brain malformation where her brain is slowly falling back through where the stem comes up into her skull. But then to make it even more exciting, she has cerebral palsy and an intellectual disability. So me and this young lady sit down to talk, which there is no doing because she's, you know, she doesn't like me anyways because I always show up at dinner time. So she's associating me with the person that slows down dinner. You know what I mean? So it's like you've got to make sure that you are really responsive to who these kids are and what their needs are. So it's all about these partnerships. Summer camp is a good thing, not only for the child, but for you. You know, get them out of the house for a week. There is nothing wrong with that. No one says that you have to take care of your child 24/7. Respite, respite, respite. There's places that do it on sliding scales. There's places do it for free. It's good for the kids because they learn social interaction, and the majority of these respite programs are designed to teach social skills. So it's not just watching a movie for a half hour. It's learning how to do something that will be valuable to them later on in life. If it's not written down, it didn't happen, and then my honey and vinegar thing. Okay, so here we go. When you have a child with a special health care need or a developmental disability within the state of Georgia, you will at some point in time interact with all three of these agencies. And to make it even more exciting, this one is coming out and is going to be moved into its own because we needed yet one more thing to do. But in all actuality, that's a good thing, because when you have certain organizations that have several programs operating within them, oftentimes it can become almost like a conflict of interest for them. So for you trying to get the service that you need and navigate through the system, and this person doesn't want you talking to this person because it's, you know, it can get really confusing. So with the fact that we've separated these out over the last couple years, it has actually been a great move for the state of Georgia. What I want you to know is, like I was saying before, when you give birth to a child or you adopt a child that has a disability, nobody gives you the Disability 101 book that says this is what the rest of your life is going to look like. No one does it, and I don't know why, but hopefully this will be, whatever you learn from me, you have to take out into the community and tell other people. You have to do it, because if somebody would have done it for you in one area of your life, it might have made it so much easier for you. So reach out to those other folks. But understanding the acronyms. I talk about DBHDD and DCH. You got to apply at DCH, you get your services through DBHDD. Everyone's looking at me like, what are you talking about? So what I need you to know is that anytime you apply for Medicaid, you are applying for a service that is overseen by the Department of Community Health. You may not apply for it there, you actually apply for it here, because that makes sense, right? You apply for it here at DFACS because they do the initial determination, but anything having to do with Medicaid, as far as whether it's a fraudulent charge or whether or not the individual is available for Medicaid services long-term, is then decided by these folks. But when you go to apply for services, it's through these people, but it's paid for by them, but you do it through, it's a disaster. It is so fragmented, but once you understand it, it will become more, I don't know if it becomes anything other than you just have a better understanding of who it is that you're working with. So one of the things that I always tell folks is when you're applying for Medicaid, the young ladies from CHOA did a great job of starting this conversation, so I'm not going to jump too much into it. I'm going to kind of take you to the next level so that you understand actually why Medicaid is so important, all right, because there is actually a reason. But in order to know that, you have to understand what Medicaid is. So Medicaid is the system that is a partnership between the state and the federal government. You operate under federal guidelines, but the state actually implements the program. Now this comes into this becomes very important later on, because as you jump from state to state, you're not going to get the same services, or at least by the same name, as you are here in the state of Georgia. So what happens in Alabama may not happen here in Georgia, and may not happen in New York, and you don't know what California's doing. So no one is really aware of how that works, but just keep in mind it's always state independent. Then understand that it is not a dollar from the state of Georgia that is paying for a $1 worth of Medicaid. It is 40 cents that that our legislative session puts into the budget, that the feds match with 60 cents, and that's your dollar. Now actually that's changed by a couple pennies, but we're not going to go there because you don't need to know that. Just understand that it is a combination of money that makes up Georgia's Medicaid program. So when the legislative session kicks in on the second Monday of January of every year, and they're talking budget, they're talking Medicaid budget. And if they do not know who out in their constituency within their districts are in need of Medicaid dollars, guess what? They're not going to do it. All right, because there's a lot of other people out there within other organizations and other service departments that are trying to get those same dollars as well. So if your elected officials do not know who you are, then they're not going to fund a system that you actually need to support your child. So we're going to have a conversation in a moment about writing letters to your elected officials, and this is where everybody rolls their eyes and turns white and is like, ah, blah, blah. You have got to do this. Disability is not a political issue. You do not have to be a Republican, a Democrat, or an independent to have a disability. Neither does color play an issue, neither does sex play an issue. Disability does not discriminate. 1 in 5 Americans have a disability. 90% of us will have a disability before our life ends. It is part of the natural aging process. So, you know, that's the importance of understanding this piece. So we've already talked about that. The most important part of this is, and the reason that I want you to have access to Medicaid is because Medicaid for a child under the age of 21 is called EPSDT, Early Periodic Screening, Diagnosis, and Treatment. Now, you don't need to know all that. I've given you 4 different handouts that address this in your notebooks. And what you do need to do, though, is have a serious conversation with your doctors and your treatment team about their power under Medicaid through EPSDT. EPSDT is not a waiver. It is nothing more than the federal language of Medicaid for children under 21. It's all it is. But what it basically says under the federal statute is this: if your doctor prescribes a service for your child that is, in his or her mind, medically necessary to correct or ameliorate that child's condition. And the reason I throw out those 2 words is this: a service never has to cure your child's health care need. It either needs to maintain it where it's at, keep it from regressing, or hopefully move the child forward. But it never has to cure it, and that's why you want to use the language correct or ameliorate the condition. So if your doctor says, I want your kid to have 40 hours of occupational therapy a week, I'm just making this up, he or she needs to write a letter of medical necessity and a prescription that is then turned over to the Medicaid service provider that they then in turn go to Medicaid to get prior approval for. So are you going to get denied? Well, if your letter of medical necessity does not explain why that service is medically necessary to correct or ameliorate your child's condition, you are going to get denied that service, because one of the things that Medicaid is charged to do is watch fraud. Now, I'm not saying that they're saying that you're committing fraud, but if they don't have documentation that proves that why that service is so important, they have to consider it as being fraud. The majority of Medicaid fraud happens on the end of service providers. It's not the people that utilize Medicaid services. All right? So EPSDT, Medicaid for a child with a special health care need, is that golden ticket that Charlie got in Willy Wonka that gave him access to the world that he became exposed to. This is so important. If you walk out of here with nothing else today, please walk out of here with the understanding that you really need to understand this. I've given you EPSDT for parents, EPSDT for professionals, so you have one you can actually give to your doctors. I do this training with doctors as well. When you go to medical school, they do not teach you how to write a letter of medical necessity. So you as a parent need to be educated enough to go to your doctor and share this information with them, as well as the written information, so they know what they're doing. A letter of medical necessity has to include the child's diagnosis, the prognosis, so how is that disability going to play out across the lifespan, the service that's being requested, and then how is that service medically necessary. And this is where doctors always leave the most important piece out, because they don't go enough into depth as to occupational therapy helps blah, 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 whatever it is, or physical therapy. Or for those of you that have children that are medically fragile, it gives you access to huge amounts of services, like an in-home health aid. If you've got a 16-year-old child that weighs 140 pounds and you have to bathe them every day and get them from bed to wheelchair or whatever the situation is, how can you do that safely if you are the only person there to do it? Are you not putting yourself at risk for an injury as well as the child? Whereas your doctor can write a letter of medical necessity saying that this family needs in-home assistance for 2 hours every day for bathing purposes and hygiene purposes to get this child up out of bed, bathed, and on their way to school. All right? So there's an entire list of services that are available to children, and this is the cool part about it. When you turn 21 and you have Medicaid, you have 3 things. You have doctor's appointments, you have medications, and you have emergency room visits, and that is it. When you're a child under the age of 21 on Medicaid, you have access to occupational therapy, physical therapy, speech and language therapy, all the other therapies that come along with that, specialized medical equipment, specialized medical services, all of this stuff that is available to you that nobody knows. So this is how you get it. You get access to your child through Medicaid using the federal language of EPSDT. And the beauty of it is Georgia's legislature back in 2008 passed a piece of legislation, and I gave you the legislation, called Senate Bill 507, that says we as Georgia understand that Medicaid is not doing what they're supposed to do in the state of Medicaid, or in the state of Georgia, so we are now creating guidelines that they must abide by. So now when you turn in a prescription and a letter of medical necessity for a service through Medicaid, gone are the days where you got the letter that said, nope, sorry. Now they actually have to explain to you why they've denied it and what you can do to reverse that decision. And this is huge because in the past, nobody ever appealed Medicaid denials. Parents, because you're so busy and there's so many things going on in your life, the thought of sitting down and writing a letter about a Medicaid appeal is just not something that you want to do. But what you need to know is that once you have access to Medicaid, what research shows us is the majority of the people that are denied access to a service the first time, which, you know, in my book, just go into it thinking you're going to be denied, so when you get denied, it's not a big surprise. But what happens is for the majority of the folks that do the appeal process actually get the service. So if you're not appealing these denials, you're not doing everything you can to access those services for your child that in the long run will make your life so much easier, because we know the more services you put in place, you know, before a child turns 22, they do so much better across the lifespan because their bodies are in a much better place and their minds are in a much better place. So that's the beauty of understanding the difference. So regardless as to what state you live in, the federal law says that if your child has Medicaid, that state plan has to pay for that service whether or not it's a part of that state plan or not. That is huge. That is huge. All right, so where are we at? Ways to gain access to Medicaid. The young ladies this morning already talked about this, so I'm not going to go back into it, but I will typically tell you how I work with the family when I first meet them. Go to DFACS, apply for Medicaid. If you get rejected, typically because DFACS Medicaid is what is traditional Medicaid or low-income Medicaid. So if you get rejected because of that, your next step is to go to SSI, which is Supplemental Security Income. Supplemental Security Income is for individuals that have disabilities that either they can work and they have restricted funding, meaning that they don't pull in a lot of money, or they're not able to work at all. What it does is it gives you access to Medicaid, which is the most important piece because that's your health insurance piece where your child's health care needs are covered. But it also gives you a check for up to $674 a month based on what your child's needs are. You can spend that, you know, on whatever it is that it needs to be spent on. A lot of people use it for co-pays, deductibles, whatever it is that you need. Because you got to remember, just because you have Blue Cross Blue Shield or Cigna or United Healthcare doesn't mean you can't have Medicaid. Medicaid is your underlying safety net that acts as what is called the payer of last resort. So if you submit a claim to Blue Cross Blue Shield and they deny it, then it needs to default to Medicaid because Medicaid needs that denial from Blue Cross Blue Shield in order for them to pay for it. So it's not that you have to have one or the other, you can have both. For those of you that apply for SSI and get denied, which again is going to be an income issue because SSI again is an income-based service, what you need from them is the letter of denial, because in order to access the Katie Beckett waiver, which is the deeming waiver, you have to have the letter of denial from SSI. So we're going to talk about Katie Beckett in a minute. Okay, we'll talk about it right now. Katie Beckett is interesting because what it does is it takes mom and dad's income out of the picture and focuses on the child and the child's needs. And it is based on the fact that Katie was a young girl that lived in a hospital and her mom and dad wanted her to be at home with them where a child should be, being raised at, with her parents instead of being raised in an institutional setting. And they went to President Reagan and said, look, as a family, we make pretty good money. We're upper, income, but we cannot get what we need for our daughter simply because of the fact that our income is making us ineligible for services. So President Reagan created the Katie Beckett deeming waiver, and that basically what the goal being is Katie Beckett takes mom and dad's income out of the picture and focuses on the needs of the child. So one of the things you have to understand is in order for your child to be eligible for Katie Beckett, he or she has to meet what is called the nursing home level of care. This does not mean that they live in a nursing home, so please do not think that you have to put your child in a nursing home. It just means that their medical needs require them, if they were not living with you, they would be living in a nursing home setting. That's basically what it means, because they're not able to provide the level of care that they need on their own. All right, so do not think that your child has to be in an institution or a nursing home. Just means they need to meet what is called the nursing home level of care. What this does, Katie Beckett is nothing more than access to Medicaid for a year. Every year you have to go through the redetermination of eligibility process. And has anyone in here done Katie Beckett? From all the families that I work with have told me that 9-page application will take you to the end of your sanity and back again. The average family spends between 40 to 50 hours completing the Katie Beckett waiver just to submit it and find out that in fact they did not have everything that they need. It gets denied and then they have to go through the appeal process. There are several things you can do for those of you that are considering Katie Beckett, because I think Katie Beckett is a beautiful thing. Anytime you can get a child access to Medicaid, you are setting yourself up for success. The thing about Katie Beckett is number one, there's people out there that you can pay to do it. So if you have the money, you know, if you have those resources available to you, my recommendation for your own personal sanity would be just to put it on somebody else and let them do it. There's great folks out there that have survived this waiver process. You know, they charge between $500 to $1,000. I'm not going to lie to you. It's a lot of work, y'all. You have to have the medical documentation from basically the day your child was born up until you are right then and there. Because you're trying to prove to the federal government why your child's medical needs are so extensive that your personal income needs to be ignored so that the child has access to this Medicaid system for a year. One of the families that I worked with, when you added up all their homes and cars and they had multiple jobs and all this kind of stuff, their assets were about $900,000 a year. And so she sat down in front of me and I'm thinking, why are you and I even having this conversation? And then she pulled out her daughter's medical bills. Her husband and her had been paying out of pocket every year $365,000 in medical expenses to make sure that their daughter was safe and healthy in the community where she belongs versus in some sort of institutional setting. That is the beauty of Katie Beckett, because even a family like that looks on paper like they're doing so well was teetering on the edge of bankruptcy. They were losing their homes, they were losing their cars, because the only way they could afford to keep up with their daughter's medical care, she had very extensive cardiac issues, was through this. So that's the beauty of this, and I think that it's definitely something that everybody needs to tap into, because this is your third way to access Medicaid for your child. DFACS, SSI, you get denied SSI, Katie Beckett. And then the young ladies already spoke to you about emergency medical assistance, so I'm not going to go into that because that is a brutal process. I mean, you're basically getting Medicaid for that month. That's just covering the cost of the medical care that your child had to receive during the crisis that happened for that month. It's not an ongoing service. And for those families that have continuing ongoing medical needs, they have to do this every month. It's worse than Katie Beckett. I mean, it really, really is. The fabulous thing about Katie Beckett is Parent to Parent of Georgia has 2 webinars that you can watch that walk you through line by line of how to fill out this application. And the woman that does it does a beautiful job. She has a child with autism, and those are, that population of people is one of the hardest ones to get onto Katie Beckett because there's not necessarily a medical component to it. So what I tell parents is if your child has autism, about 1/3 of all children with autism also have seizure disorders, so a lot of them also take medications. There's your medical. So you have to look at, you know, how are you going to piece this together? Is the child being treated for ADHD? We as a people have now come along to understand that ADHD is not just a child's inability to behave themselves. It is actually a neurological disorder that is genetic, that passes through a family. And I have worked with some families where mom, dad, and all 5 kids have ADHD, and you walk in that house and it's like, holy mackerel. Talk about organized chaos. It's just all over the place. And they're all on medication to treat it. There's your medical piece, all right? So you got to be creative and you got to work with your doctors and look at every aspect of your child's life and what is being done as far as treatments are concerned, because that's how you tap into that medical piece. So the importance of Medicaid doesn't stop at age 21, because what you have to start doing is what is the plan for after 21? Every parent that I work with that has a child with a disability, I always say to them, do you want this child living with you when they are no longer a child and they are 40 years old? Absolutely not. Absolutely not. In my mind, with the kids that I work with, as soon as they turn 21, you need to find somewhere else to live. I will help you get there. I will teach you about all the waivers that make that possible for you. I will help you find supported employment if that's a possibility for you. But ultimately, if that child is going to grow up to become an adult and have a life that is in any way based off of their choice and their independence and their self-determination, they can't necessarily always do it under the roof of our parents. Because as moms and dads, sometimes we struggle with when is it time to let go and let our children become the adults that, you know, we all want to be. And regardless as to the level of disability that we have, ultimately you should always be trying and striving for some level of independence. And I completely understand that in some circumstances, a level of independence may only be the child's ability to pick out what they want to wear that day. You know what I mean? Everybody needs to be treated separately. There's some kids that are going to do really well and are going to go on to have these fabulous lives within what they picture their life being. And there's going to be other children that their life is going to be just as fabulous, but it's not going to have that same look. All right? So what I tell parents is you need to get your kids signed up on Medicaid waivers. Medicaid waivers are the waivers that have been created. They are in every state across the nation, and they were created to make sure that people with disabilities do not become institutionalized or segregated from the general population. This is a huge issue for me because my family, because again, we were talking back in the 60s and 70s, this stuff was not available yet, because at that point in time, if you gave birth to a child with Down syndrome, there was not a conversation about living at home. It was, there's the hospital that that kid needs to go live in, and that's where they were sent. Well, my aunt and uncle were brave and said, we're not doing that, we're keeping our girls home with them, our family all lives on the same street, we're going to make this work. What we did not do is we did not put in the will what was going to happen should my aunt and uncle die. For whatever reason, that never crossed our minds. But I promise you, 9 out of 10 families that I talk to, I say, what is the plan? We don't have one. You have got to have a plan. You have got to have a will. So when you leave here today, go home, get on the web. You can download them right on the web now. Just pick somebody in your family or somebody that knows and loves your child the way you do, so that, God forbid, something should happen to you when you leave this building today, your child is not going to end up in a nursing home. And if you do not know that there are children living in a nursing home, then I need to be the one to tell you there are. Because a lot of families are so financially strapped and struggle so much, or maybe just don't have the ability to provide the level of care that their child needs without the supports and services being in place. The only option for them was for their child to end up in a nursing home or in a state-operated institution. This is something that is so important to me because we didn't do that. And when I turned 21 and I moved down here to start my life, and my mom went on to do her thing, and you know, families just kind of over 20 years, everybody moves on to different things and, you know, moves out of the neighborhoods. My aunt and uncle passed away in their 70s. There was no plan in place, and my cousins, who were at this point in their 40s, ended up being moved into an institutional setting. Now, my cousin, obviously they both have Down syndrome, which is actually kind of odd for one family to have 2 children with Down syndrome, but we're just that kind of genetic pool. What happened with them is they got put into these institutional settings with Down syndrome. Like I said, oftentimes comes the cardiac piece. Nobody in the institutional setting, and I'm not saying the people that work in these settings are not bad people. They are great people that dedicate their lives to caring for these folks that come to live there. What I'm saying is the setting is in no way appropriate for a person, because you have no choice about your life at all. So what happened is my cousin had congestive heart failure. But nobody was paying attention to that, and because of her limitations and her abilities to share what was going on with her body, and in addition to the fact that no one was listening to what she was telling them, oh, she's just, you know, they discount it simply because her IQ is at 70. She doesn't know what she's talking about. We know what it is. So she ended up dying. And it happened within a relatively short period of time. And it was a very devastating thing for our family because we felt like we dropped the ball. And the thing that always touched me about my aunt and uncle that I learned very early on, and I learned this through my mom as well, is even though our child is born with a disability that we actually play no role in as a parent, we still carry the guilt. Did I do something? Is there something that I could have done differently? There wasn't, and there's not. And there's no reason to even go there, because disability is natural and it's a part of everybody's life. So rather than beat ourselves up about the cause and where we're at, why not just accept that this is where we are and move forward with producing a productive adult instead of a child that is going to be dependent on you for the rest of your life? So what happened with my other cousin is they used to go on, well, they started going on outings. And she had a very unsteady gait and always needed assistance when she was walking. So they're getting onto the bus, no one's paying attention to her, she falls off the bus backwards, off the steps, hits her head, and now she's in a coma. So again, I'm going back to the fact that it's not that the people that work in the institutions are bad people, they're not. This is not where people need to be living out their lives. It is not appropriate to be segregated from the rest of the community simply because you have a special health care need or a disability. We now have supports and services available to us that will allow these folks to stay out in the community. So that's what we're going to talk about next. So there's a bunch of different Medicaid waivers out there, and I'm not going to talk about all of them because this could be a 2-hour conversation, but I gave you a booklet called Home and Community-Based Services. This outlines every Medicaid waiver available in the state of service, who is eligible for it, and how you apply for it. So this is the contact that you need. So for an example, say like you have a 7-year-old that has heart condition issues, and maybe there's some pulmonary issues going on, and maybe some GERD, some reflux, or maybe they have epilepsy and they're on meds for that. There's a program out there called the Georgia Pediatric Program, the GAP waiver. And what that does is that gives parents access to either a medically fragile daycare center or provides them with in-home skilled nursing. So what I tell folks is you need to determine, based off of whether or not your child is eligible for the GAP waiver, what do you want out of it? Do you want to keep working? If you want to keep working, then the medically fragile daycare center is probably the best way to go, because it's a bunch of nurses and physical therapists and occupational therapists that just work these little people to death while they're in there. And then you're out in the community, you're working, even if you don't want to work, you still have the ability to stay in touch with your community through the work that you do, whatever that may be. Or you may want to say, well, you know what, I'll just do the in-home skilled nursing piece. And I love this because a lot of the kids I work with are on vents and trachs. And I'm always really nervous about vents and trachs, because when mom and dad are trying to sleep, which they need to be doing, who is making sure that there's not a mucus plug? Who's making sure that the power doesn't go out and the vent has no power? You know what I mean? So that's where that in-home skilled nursing piece comes into place, because you would get a nurse put in place who could come in for a certain period of time, and parents can use that opportunity to take a nap, take a bath, whatever it is that you need to do for yourself. So that's the GAP waiver. It offers a lot. I think it's a great program. The independent care waiver program is for individuals that have physical disabilities between the ages of 21 and 64. This also includes the population of folks that have traumatic brain injury. But this waiver is specifically for those folks that are actually able to self-direct their own care. A good example of this was a young man I met. He's 25 years old. He is completely paralyzed from the chin down. So that was me. So he's got his ventilator that is like built into the back of his wheelchair. It's the most bizarre wheelchair I've ever seen. It's really cool. It has this little blowpipe that comes out of it, and that's how he gets around. Well, through the independent care waiver program, he has a 24/7 nurse that follows him around through his daily activities so that he is able to live the life that he wants to live. He goes to college. She helps him get up in the morning. She goes to class with him. Just, God forbid one of the hoses pop off or something. There needs to be somebody there that can plug him back in to make sure that he, stays safe and healthy. He goes skydiving. I mean, what would have been a person that would have been living in a nursing home, which would have been heartbreaking, because cognitively there is no issue with this young man. He's brilliant. He's going to college and doing well, is out skydiving and going to college every day. So that's the beauty of what these waivers have to offer. The other two waivers that are of particular importance to me are the new options waiver and the comprehensive waiver, and I've actually given you an application for those. So for those of you that have children that have developmental disabilities, in addition to any cardiac concerns they may have, this would be the waiver that you would want to check into. This is the waiver that, should your child move into an apartment after school is over, they would be given a budget of up to a certain amount that helps them get the services they need to allow them to remain safe and healthy on their own. Because some people just need someone to make sure they take their meds every day. So a nurse comes in, watches the kid take his meds, her meds, whatever the situation. The nurse goes on to her next client, and the person goes on to live their life. It's a great waiver. That's the new options waiver. It is specifically for those people that are already living in the community. The comprehensive waiver is a waiver for obviously people that require more comprehensive support services. So for all of those people that are currently institutionalized, we have 7 state-operated institutions in the state of Georgia. And there are currently 800 people still institutionalized that have developmental disabilities that are being moved back into the community through some lawsuits and some federal legislation that I'm not going to talk about right now. We'll hit on just for a second, because it's important that you know this stuff. The comprehensive waiver is what we use for those folks to be transitioned into the community. They can live in what's called a host home, which is a family that lovingly opens their heart and home to an individual with a disability to come live with them. It's supposed to be like a room and board thing, but it actually ends up becoming this huge family thing because mom and dad of the child are involved, and then you have the host family that's involved, and you end up with this huge family, which I think personally is a beautiful thing. And it's nothing more exciting than seeing 10 different people who have never met before come together to support somebody so that they can live a life of choice and independence and go on to do and become who they want to become. This is great with a lot of the young folks that I work with. I work with a lot of folks that have cerebral palsy. I like the comprehensive waiver and the now waiver because it provides them with the funding source that they need to live in a residential setting that is most appropriate for them. So do you want to live in your own apartment? If that's not an option, then maybe you want to live in a host home if you're not really comfortable with that, or you require, or maybe the person's a little bit more social and wants to live with other people. They have what are called personal care homes. It's a home with up to 4 people that live within the home, and they all have very similar disabilities and hobbies and interests and stuff like that. And then there's a house manager who runs the house. You eat what you want to eat every day. You wear what you want to wear every day. I mean, it's a beautiful thing. And the reason a lot of this came into being was back in 1999, actually 95, 2 women institutionalized in the state of Georgia, Lois Curtis and Elaine Wilson, wanted to be moved out of the institution, and they wanted to live on their own. They felt that they could do it with a little bit of community support, and their doctors were like, you do not need to be here. With a little bit of support outside, you could be doing your own thing. So they asked the state of Georgia to move them out, and the state of Georgia said no. So they sued the state of Georgia. It went to court. The court said, you know, under the American with Disabilities Act, Title II, people with disabilities have the right to receive services in a public setting that is also a least restrictive environment. So yeah, by segregating them into an institutional setting simply because they have a disability, that is in fact a violation of their civil rights. Move them out. So Georgia appealed because Georgia's like, we can't afford to do this, it's too much money, keeping in mind that 1 year for an individual with a developmental disability in a nursing home setting is $95,000 a year of Medicaid dollars. I can do that same thing in a host home or a personal care home setting that offers this person the ability to do whatever they want with their life for 1/3 to 1/2 of that cost. So are we really spending our money in the best way? So not only are we segregating a population of people just because they have a disability, we're also not really taking advantage or using our Medicaid dollars in a way that is most beneficial to everybody. So one of the things that got me was I've been kind of involved with this for a while, and I was going around meeting some of the folks that were being moved out of the institutions into personal care homes and into host homes, and some of them are really cool, and I would spend time getting to know them just as people to see, you know, what this meant to them. I wanted to know what this was going to be like. So anyways, jumping back to Lois and Elaine, so they appealed, Georgia appealed the decision. It went to the federal court. The federal court said, you know what, the ladies are right, you can't do this, this is discriminatory, move them out. Georgia appealed it. It went all the way to the United States Supreme Court. And in 1999, Justice Ruth Bader Ginsburg passed down the decision that said it is in fact a violation of your civil rights to be institutionalized and segregated from the general community simply because you have a disability. Once that Supreme Court decision happened and that became the law of the land, everything changed, with the exception of Georgia, because we always kind of lag a little bit behind everybody else. But everybody else started emptying their institutions and moving these people out into the community. Lois and Elaine moved out into the community. Elaine passed away a few years after moving out, which was unfortunate. But Lois has gone on to live this life of just, it's amazing. She sits in these coffee shops and does these caricatures of people. She sells them in an art gallery. She started a greeting card line. She makes these refrigerator magnets. You know, she works with her strengths. She works with what she is able to do and what she's loved to do, and she's actually now paying taxes back into the system that in turn supports her in the community. It is a beautiful thing. I mean, you could not ask for anything better. 70% of people with disabilities do not work. 65% of those people want to work. What is going on? These people need to be working. They need to be paying back into the system that is supporting them. Plus, they want to be a valued member of society. That is all they want. So the new options waiver and the comprehensive waiver are fabulous for this. I met a gentleman, I can't say his name, we'll call him Mark. Mark was in an institutional setting for about 45 years at Georgia Regional. He was being transitioned into a personal care home under one of these waivers. No one really knew much about him. He didn't talk. You know, obviously, he just kind of did his own thing, sat in a corner. On the day that he was being transitioned into his personal home care setting, he was with some of the folks from the hospital who were driving him to the new place, and he started talking about the trees that they were passing, and the woman driving the car almost wrecked. She's like, I have known you for 30-some years, and you have never said anything. He said, well, you've never asked me anything. Institutional settings do not give you the flexibility of deciding what you want to wear that day, what you want to eat that day, who you want to talk to that day. Maybe you don't want to get up that day. There are plenty of Saturdays, and this is gross, this is plenty of Saturdays where I get up and I just don't necessarily want to take a shower that day. I'm going to hit the couch and I'm going to stay there until it's time to go to bed. Not the prettiest picture, but I have the right to pick that for myself. Why should my cousins not have that same right? If I don't want to do something, I shouldn't have to do it just because it's policy for that particular institutional setting. I should be allowed to wear what I want to wear, watch what I want to watch, and do it when I want to do it. So that's the beauty of these programs. One of the other ones that I like a lot is the source waiver, and this may be of particular importance to you all. The source waiver is a waiver that requires that you be SSI eligible, and you have to have a medical component to the disability that you have in order to access this waiver. This waiver has no waiting lists. All the other waivers I've discussed so far, with the exception of the Georgia Pediatric program, the GAP waiver, that has no waiting list either. But the source waiver is the only waiver that does not have a waiting list. This is simply just state dollars, so you don't have to worry about that federal matching piece. The new options waiver and the comprehensive waiver have a waiting list of 5,000 people right now. That is who the state assumes is in need of services. There are 17,000 people with developmental disabilities in the state of Georgia currently living with a caregiver over the age of 65. Tell me we are not heading into a really scary situation. We are one hip break or one cardiac event for a caregiver where this person, their child that has been living with them for 40 years, is going to end up in a nursing home setting. You know what I mean? So we need our legislature to understand that when they go in to fund these Medicaid systems every year, our families need these dollars, and not only that, we have been paying into this system the entire time we've been working. We are entitled to those dollars. That's why they are called entitlement programs. There's this big misconception within the political world and the rhetoric that we use about what an entitlement program is. You're entitled to the program because you have paid into that system the entire time. Does that make sense? So this is how people, you know, you've been paying taxes all these years. Your child should be able to benefit from those dollars that you've been paying in to live the life that they want to live, and for you to have the support services you need to make, you know, you need to make sure they have that life. So anyway, so the source waiver has no waiting list. It just requires that there be some sort of medical involvement, and then you have to meet two other criteria. Either it be a developmental criteria or a mental health criteria. Oftentimes, you may not have one of those other two pieces, so you'll have to tap into other services. Every county has what is called Children's First. Under Children's First is Babies Can't Wait and Children's Medical Services. Children's Medical Services was designed to help parents pay for the cost of their children's medical needs. How many people knew CMS even existed? You know what I mean? It's like, why are we not telling? In my mind, every time you give birth to a child that has some sort of special health care need, someone should say to you, these are the 15 people that are going to help you move your child forward and educate you on what the process is so you understand what systems you're working within. So the source waiver is a great thing. It's great for those kids that graduate from high school and you're not really sure what to do with them because they're not going to necessarily be able to work you know, 5 days a week like many of us do, you can go to a day program. They have programs where these individuals go, the source waiver pays for it. You either learn social skills or you learn job training. It pays for job training, it pays for people to help you find a job. I mean, there is just some great stuff out there. But if you don't tap into it, then your child is not going to receive the benefits of it. I guess we kind of need to go to the ugly part of this. We've already talked about this. We've already talked about the American with Disabilities Act. This is the Olmstead decision that moved Lois and Curtis out. Yes, sir?
You kind of moved past the wills and the trusts.
Oh, where's that at? Where's that at? Well, you know what? We're just up one?
Back right there.
Woohoo! Okay. The importance behind this is this. If you have a loving grandma, well, your parents, and they pass on and they want to do something beautiful for your child by leaving them $10,000, they've just booted your child out of the service system. Money cannot be left to a child that has a special health care need that is receiving any type of services through the Medicaid system or the Social Security Administration, because basically what you've done is you've just provided them with income. So they are no longer low income. They now have an income, even though you and I know it's a one-time shot. They are going to be booted out of the service system. So you need to have a special needs trust. A special needs trust is the way that you leave your estate or your loved ones that want to leave money to you or your child. That's how you do it. It gets funneled into this. This is legal. It was set up specifically for this reason, to make sure that your child doesn't get booted out of Medicaid services simply because you wanted to do the right thing by leaving your estate to them. So if you do anything, and then the wills thing just goes back to what I was talking about before, you have to have a will. And I know this is not a pleasant conversation, and trust me, but let's be honest, folks, we got to do it, because if we're not doing it, then we're not setting our children up for success. Yes, sir?
What happens if I die and he gets life insurance, that's the same?
Yeah, because once you get life insurance, that then becomes an income. You know what I mean?
Can't you set up the life insurance?
Yes. Then that's what you do. Your life insurance policy gets funneled into your special needs account, which is a protected program that does not count as an income against your child. Yes, ma'am.
Right now, I have a child, she's on the life insurance, so I can set that up as special needs.
Yeah. What you do is, in the event that your life should terminate, kind of sterile, but in the event that your life, your life ends, you want to make sure that that money is directed into a special needs account, because this is the only way. Now, someone may know of other ways. Like I said, I don't know everything, but I do know that most of the folks that I work with, this is the route that they take, because this is what protects your child from losing services. They still get the access or the benefit of what you've willed to them, but it doesn't boot them out of services.
Well, I'm with the school system, so I need to contact that particular company.
Yeah. Because you're on the state. Yeah. And I will tell you too, go online and just Google special needs accounts. There are people all over the state of Georgia that do this. You can do it yourself, and if you're that savvy, you've seen me struggling with this thing, so I obviously would not do it myself. I would have somebody else do it. But you can do them yourselves. I mean, there are programs that will walk you through it, but you just need to keep in mind that there's a lot of loopholes that you need to make sure are closed, because you don't want to do anything that you didn't realize was going to ultimately affect the services for the child. Yes, sir?
So you're saying you need an attorney to set something like that up?
I say if you're an attorney yourself, or you're pretty savvy with stuff, you can actually do them yourself. I mean, you can get the programming for it. That's why I would go to a lawyer. I seriously, there are lawyers that do nothing but special needs estate, will, funds, trust. Yes, ma'am.
Question about the CMS. I'm a single mom, and I make too much money to qualify for any kind of services, and my child is wonderfully healthy right now.
Good.
But I have trouble making the $250, $500 payment for what's left over for the tests he needs every year.
Exactly. That's the reason that I like CMS and other programs like that. For example, and I know, again, this is not this audience in particular, but for children that have autism, there are a lot of autism foundations out there that do $250 and $500 grants to families so that you can pay for a service for your child. That's the importance of tapping into that organization that represents your child's disability. Because like the Down Syndrome Association of Georgia has this fabulous program that when a parent gives birth to a child with Down syndrome, a parent of a child with Down syndrome goes into the hospital with a welcome to, you know, the Down Syndrome World packet and starts a relationship with this family instead of this family trying to wrap their minds around having just given birth to this child. Everything changes. I mean, that's the reason I gave you that Welcome to Holland poem. You know what I mean? It is a tearjerker, and I don't recommend reading it right now, but what it does is it points out the fact that, yeah, our children have special needs, but it does not make them different than anybody else. You know what I mean? So my thing is tap into those organizations and find out what's available. Easter Seals of Georgia has a program called Champions for Children, and it is only available to people that cannot access anything else because either income or insurance or something else makes them ineligible for one of these other programs. It is designed for folks like yourself that can't access some of the other services, and they do a great job of providing assistance in some areas. Tap into what's out there. There's a reason that people start these foundations. Like one woman started a foundation, the Morgan Project. A family started it because their child had a lot of needs, and they recognized what it's like for a mom and dad. So they took, you know, he passed away, so they set up a foundation that they give money to families so that families can get access to services or summer camp. Tap into that. Tap into that. It's there, you know. It's out there to be taken advantage of, but definitely check into Easter Seals of Georgia Champion for Children's program. And then every county has a children's medical services office. You have to just go through your public health department or your county health department. So how are we doing? 10 after 2. Okay. What time am I going to? 2:20?
2:20.
All right. Where are we at? We talked about institutionalization. Again, the Georgia Medicaid waivers. Folks, I gave you an advocacy packet because I want you to know that when you're interacting with your state officials, this is not rocket science. These are just people. They are no different than you or me, except they just have this thing that, you know, they want to be in this position and help move our state in a positive direction. If they do not know what is going on with your family, they are not going to make educated decisions about the services and the programs that support our kids. It's not that they don't want to do it, they don't know. So if 8 of you, the current statistic right now is that if a federal or a state legislator gets 8 letters from his or her constituency about a certain topic, that in their mind and statistically means that everybody within their constituency is suffering with that same thing. So really, if just 10 of you in your neighborhood that have children with special health care needs write to your elected officials and say, hey, my name is Joe, I have a child that has cerebral palsy, I want to let you know that it's very important to my family and my child's future that you fund systems adequately to make sure that my child has the right to a life that the rest of us take for granted. You know what I mean? It's not about going down there with a pitchfork and a torch and beating them over the heads. These people get beat up all the time. You want to just present your family. You want to send a picture. I always have the families that I work with send pictures because that is what gets it. Let's face it, we got the cutest kids in the world. You know what I mean? Any kid under 12. They get kind of scary once they hit 12 and the hormone thing starts. But you know, these are such cute kids. Use that to your advantage. It's not exploiting your child. It's giving your child a voice that your child does not have. You are that child's voice until that child is old enough to establish his or their own voice. But it's easy. It's 3 paragraphs. We live in your area. Johnny has cerebral palsy. This is how it affects his life. Please make sure you're having a conversation with your colleagues about funding the Medicaid system. That is it. That is it. That is all they need to know. Really, all they need to know is that first paragraph, but the next 2 paragraphs just bring it home. If you did not have a child with a special health care need that brought you to this room today, you would never understand the life that you lead now as you know it. Do you know what I mean? So we cannot expect these people to know that. And it's so interesting to me, there was one particular, I don't even know if he's still in office anymore, so I'm not going to say his name. He and I go down to the Capitol all the time. There's an Unlock the Waiting List campaign where you go down and you pull your legislators out to the rope and you do your little 2-minute elevator speech. Hi, my name is Joe, I have a child. I need you to fund the Medicaid waiver programs. Thank you so much for your time. And then you go on and they go back into the session. And I completely forgot where I was going with this. What was I talking about?
One individual. You're not going
Oh, yeah. So for years, I kept beating my head against the wall with this guy because I was like, you're going to get this if it's the last thing that I do. And he would not get it. No, we are a society that is based on individualism. We pick ourselves up, blah, 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 which I'm completely on board with that too. However, if you don't have arms, then how do you pick yourself up? You know what I mean? It's recognizing the people for who they are and understanding that not everybody comes with the same skill sets. We all have different strengths. All of our children have strengths. We need to focus on those strengths. So my strength was getting this man convinced that he needed to do this. 2 years later, his grandchild was diagnosed with autism. Biggest advocate in the world. Biggest advocate in the world. He now supports every piece of legislation. You know what I mean? It's not until it's in your front yard do you truly, truly understand it. So rather than taking that approach where I want to go down there and choke them, because that is sometimes what I want to do, you know, we all become frustrated. You have to step back, take a deep breath, and say, you know what, rather than get angry and have a conversation that is going to go absolutely nowhere, why not approach it from an angle of, let me share my story with you, my child's story with you, or let your child share that story with them. That is what makes the change. And that's why we are seeing growth in these programs, and we're seeing more and more dollars allocated to the services our kids need, because parents are angry and they're tired of not having access to what they have been paying into a system for years, and they're not taking it anymore. And that is going to be what changes how our community addresses people with disabilities. I can go all over the state and do this workshop, and you know, I carry a little bit of clout because I have two cousins that had a disability, and that was part of my life. And I work with 77 kids in a foster care program that all have disabilities, and I worked with 300 moms and dads like yourself last year to help them navigate social service systems. Still not going to have the impact that if you take 10 minutes out of your day to write that letter to who those folks are and just say, hey, I just need you to know we're out there, and that my child deserves to have the life that he or she wants, and it's up to us as a community to make sure that everything is given to them. They need to have every tool available so they can grow up and become who they want to become. All right? So we could have, there's usually, I go into the school systems and all of that. Everything I've told you is applicable to the school system. You know what I mean? It's all about finding your voice, all about understanding what your rights are, and understanding that when it comes to your child, if you don't demand that it happens, it won't happen. You know what I mean? So that partnership with your schools and your doctors, that's what creates productive and healthy adults. So, yes, ma'am.
Can I ask just a quick question about school-related stuff?
Yeah.
Do you have any good advice or tools about how to get past the big roadblock with all the budget cuts and everything?
Yeah.
Like,
the interesting thing,
I'm
I'm
going
to put this down because
these
I don't interact well with these things. The interesting thing about the school system, and I guess that a lot of folks just don't understand this, is the Individuals with Disabilities Act is federal legislation. And basically what it means that if your child is determined eligible to have special needs and require those educational supports to help him or her through the school system and get the education that is their right under the free and appropriate public education piece of that thing that we call IDEA, they have to do it. So if you have your child evaluated for services and it comes back, yes, he or she does need extra supports within the school system, and you have an IEP, an individualized education plan, if it's written in that IEP, it has to happen because it is federal law. The IEP is a federal contract between the school system and the federal government that allows them to pull down funding. So the best way for me to explain this to you is, like, I had one family that the child had on their IEP, they were supposed to be getting OT services, PT, occupational services, physical therapy services, and speech services. Well, when we sat down to discuss the progress that was made on the goals, there was no progress on the goals because there was no speech services implemented. And I was just like, you know, you have to do that. If it's in that plan, then the school system has to do it. Now, it may not always look the way you want it to look, because we are going to always want something for our children that may not necessarily fit within what the capabilities of that legislation are. And the perfect example of this is any goal that you set up with your school system has to be education related. If it's not education related, then it's not something the school system has to provide. I have a great book. If you email me, you all have my email on the front of that thing. I will mail you this booklet. It was created by Jean Estes, who is a lawyer here in Georgia that has a child with special health care need. She read the Individuals with Disabilities Education Act and rewrote it in language that we can all understand. She gave you forms that you can copy to submit for services and evaluations, and I'll be more than glad to send that to you. Yes, ma'am.
What do you do to get around, some counties have developed a loophole, and that a child, the teacher will have data that proves that a child qualifies for a specific program.
Mm-hmm.
It's not written in the IEP yet because they're trying to determine eligibility.
Yeah.
It goes to the county office, and the county says, well, we only have 5 slots available in this program, so we're going to deny the child that service.
They can't do that. When a child is eligible for a service, if they can't do it within those bricks and mortars, then it is their responsibility to find the building in the school system that can do it for you. And you start off local, and then you keep expanding out until the service is identified that was needed for that child. So in other words, like there was one family that I was working with, the child had autism, and it was classic autism. Again, some of you are probably familiar from what you see and stuff. And the school was like, well, we don't serve that population of people. And my next question was, well, then what are you going to do to get us to where we need to be? Because I'm not leaving this room until this child has somewhere to go. Because the thing that parents don't understand is if you don't sign that IEP, it's not a valid contract. If you sign an IEP, even if you don't agree with what's in it, you've just sort of sealed your doom on that. So one of the things you want to do is an IEP and all the evaluations always take place first prior to the placement conversation. So you need to get all of everything else done first and then say, okay, if school A can't do this, then what are we going to do to get my child to the school that does do this? And it is the school system's responsibility to do that.
Change happens in the middle of the year.
Which always happens.
Your IEP written for that year, you demand a new IEP meeting.
Oh, let me tell you folks, IEP meetings can be every 2 weeks if they have to be, and school systems get so, and if there's a teacher in here, I'm probably going to get beat up in the parking lot. I am so sorry.
I've been in so many, it's so funny.
But the reality of this,
for the child.
it is, and this is what I do. When I'm working with the parent and we go into an IEP and I tell mom and dad, you need to bring your goals, and we'll compare those with the school's goals, and we'll let everybody come up with goals that we all feel are appropriate, and then we'll get it down on paper, and when we all agree, we'll sign off on it, and then in 2 months, I want to meet again because I want to know where we're at 8 weeks into this, because what you'll do is you'll write these goals. 60% of the time, he will use 15 to 20 words. I don't even understand what that means. So, you know what I mean? It's like, what does that mean? So I go in 8 weeks later, I'm like, how many words have we learned? None. Well, then let's revise this IEP and make it so that it's more appropriate. I was telling some folks I was talking to, I went into one room and they had a room full of wheelchairs with individuals that had severe to profound disabilities, and they were teaching them fractions. And I'm like,
because we're required to.
and I know, and that's why, now this is where I love my school teachers, and I'm like, y'all, I know you have to do this. I know you have to do this. But parents need to raise up and say, look, my kid needs to learn how to get dressed. Let's do fractions after we've conquered buttons and zippers, because, you know, what is the reality of this child that has an IQ of 25? And trust me, I always believe that everybody has the potential to become whoever it is. But there are some points where you do have to recognize there are going to be some limitations. And teaching fractions to an individual who has no concept that they even have shoes on is not appropriate. It's not appropriate. So what are we doing, you know? So that's the parents again. Parents have got to raise up and say, no, this is broken. This is broken and we need to change it. Yes, ma'am.
And what do you do if you have an IEP in place and the school just will not follow it?
No, good question. And this is how you do everything, folks. Do not level jump. If you jump from your child's teacher to the office downtown at the Twin Towers, you have irritated so many people in between there that I promise you're not going to come out of there what you want. Start local and build up. So my first letter, because we do everything in writing, is to the special ed teacher, the school principal, and every county has a lead special education person. You need to know who that person is. That's the first letter saying, I'm very concerned, things are not being met according to how the IEP was set up. Can we please reconvene and discuss? Go in there with donuts or chocolate, and I kid you not, everybody will tell you, IEPs are either at like 6:30 in the morning when everybody's delirious, they're right before lunch where this poor teacher is about to pass out.
6:30 in the morning when you're at work.
Or exactly, or it's at the end of the day and this poor teacher has just spent 8 hours in a room with 30 children that have autism, and she herself is borderline having autism now too, just from the being around that. You know what I mean? You pick up on that energy level, and then you're expecting them to have an intelligent conversation? No. Bring donuts. It's a peace offering. Plus, it jacks up everybody's sugar level, because if you're like me, when I don't eat, I get really mean. You know what I mean? So you get everybody in the room relaxed. Then if you don't get what you want from that, that's my next letter goes to the superintendent of the school system. I copy the principal on it, and another copy again goes to the lead special education person to request a meeting. If that doesn't happen, then I write a letter to the young ladies down at the Twin Towers, down at the Department of Education. I have never had anything go to the Department of Education downtown where it did not resolve on behalf of the child.
We sit there in the meeting with the principal and her special ed needs teacher, and oh yeah, we're gonna do this, and we're gonna do this.
That's why I teach my foster parents. Yeah, that's why I teach my foster parents. Number one, you have to be present. Number two, don't go alone. Bring somebody with you that can take notes, because you cannot talk, think, listen, write, react, get emotional, and do all that and still actually walk out of there and remember what you even talked about in the first place.
And then they allot you like 1 hour.
Right, well, and that's the other thing too. IEPs, I do IEPs all the time where we get 3 hours into it and everybody's ready to go across the table at each other, and I just say, let's come back next week and finish this up. You have that right. You have that right. IEPs do not have to happen in that same day. Y'all email me, I will send you this booklet. Yeah.
I mean,
The booklet that I can send you about education is phenomenal, and it's everything you need to know.